Experts say that the number of young people dying from undiagnosed heart conditions may be up to 25% higher than previously thought. The condition is one of the biggest killers of the under-35s in the country. Well, Dr. Iqbal Malik is a consultant cardiologist at Hammersmith Hospital. As you can see, he's here with me now. Thanks so much for joining us.
Delighted to be here.
What's your feeling about this? Do you think that heart problems in young people are probably more common than official figures would suggest?
I think they are underestimated because the more we look, I think the more we're going to find. So if we talk about unexpected death, then in an older person, I'm afraid older is anyone over 35, then it's about 1 in 1,000 people might have a sudden death. It's much less common under 35, and it's still going to be 2 or 3 in 100,000. It may be more than that, because of course if you have a car crash and you die, the question is whether you lost control of the car or was there a cardiac condition underneath. So I'd say the experts are probably right that it's slightly more common than you think. The key is how to find it before anything happens.
Well, yes, how do you do that? Is screening the answer?
So I think screening the whole population is not evidence-based. It will be very expensive and likely to worry and frighten people rather than find the people who are really going to have a problem. So a better method would be that, unfortunately, you have to find the first person in the family by taking a history, someone under the age of 50 suddenly dropping down dead, or you having unexpected symptoms, blackouts for no good reason, not seeing blood and fainting, but actually unexpectedly collapsing. That needs to be checked out, and also probably the rest of the family needs to be checked out. So sentinel screening, find the initial case, screen everyone associated with the family thereafter.
And it's interesting that you mentioned the family. Are you suggesting then that a lot of the problem is genetic?
There's a large chunk which will be genetic in the younger population, and it's actually a question of finding the right cause. So, of course, coronary disease is what happens in older people. It's becoming increasingly common in younger patients. I've treated 2 people under 30 with big heart attacks recently. And so that we need to hunt out for, but the difference with the older population is those inherited cardiomyopathies, the muscle diseases like hypertrophic cardiomyopathy, and strange salt imbalances in the heart which can lead on to rhythm disturbances.
So why do young people tend to have heart attacks if it's not a genetic predisposition? Because you think of older people, perhaps some lifestyle decisions that they've made may have affected the health of their heart, perhaps a bad diet or poor exercise. But what about in young people?
So in the young people, obviously, if there are drugs involved, then that can certainly precipitate a cardiac arrest. So I'd avoid those. The risk of coronary disease is slowly rising in the younger population, despite the fact that older people are smoking less. Maybe the message hasn't got through, so we still need to work out they don't have coronary disease. They don't have, for example, a very high cholesterol that was never tested for, because that can precipitate coronary artery disease. But I think the focus also has to be making sure we screen for those genetic conditions.
Is there sometimes a problem with treatment as well, that if a young person is having a heart attack or a cardiac arrest of some kind, that other people won't recognise it as such because they think that person's too young, and they won't recognise the symptoms as quickly as they might do in someone older? Yes,
well, certainly I think that is a case, but of course we know that often the first presentation of these conditions is death. So these warning symptoms of dizzy spells, of blackouts unexplained, really have to be taken seriously, and the doctors have to take a detailed family history, because sometimes it's labelled as epilepsy, of course. So people have collapsed in the family for no good reason. It's labelled as epilepsy. It may have been cardiac blackouts that were occurring, and that was the warning sign to say investigate further.
So what's your advice for people of all ages, the best thing they can do to guard against this kind of a horrible eventuality?
So I think living healthy, we all know about, there's enough information about that, but the specific warning signs are, if you know there's someone in the family who under 50 has unexplained blackouts or died, or if you yourself have these symptoms, the blackouts, rather than just chest pain or breathlessness, although they should be investigated, but the blackouts, I think, are the key feature. If you have those, you really should be checked out, and no pat answers given to you about how it might be nothing. It may be something serious, so get checked out properly.
OK, Dr. Iqbal Malik, very good advice. Thanks very much indeed for your time.
Thank you.